Hello friends, I am Dr. Sonal Parihar. Welcome back to your own YouTube channel Ask Your Gynecologist. So what is today's topic? Today we are going to discuss about prolapse of uterus. Now what does prolapse mean? Prolapse means when any organ of your body tries to come out through the communication that it makes with the atmosphere. Like for example rectum. Rectum has a communication through the anus which helps in passing stools. So when the rectum starts coming out, it's called rectal prolapse. Then the bladder. The bladder in women and the uterus in women, it can easily prolapse through the vagina because it has a communication there, right? So today we are going to discuss uterine prolapse. Now what causes uterine prolapse? If you look at the diagram, the uterus is well connected with many ligaments and muscles which actually holds it at the right place. Now there may be Mackenrod's ligament, cardinal ligaments, uterosacral ligaments, round ligaments. All these ligaments pull the uterus from both the sides and keep it in the proper shape and position. Now, whenever there is a damage in the ligaments or in the muscles, the uterus starts sliding down. What are the causes that causes damage? First of all, childbirth. Every childbirth leads to some little damage in the ligaments of the uterine support as well as the muscles and the ligaments which support the perineal floor, which support the vagina, the uterus, the cervix, all the perineal structures. So childbirth is one of the major factors. The home childbirth, especially the births conducted by the guys, they have a tendency of pressing the abdomen to deliver the baby, and that causes further damage. So please avoid home childbirth. Now the second reason why these ligaments and muscles they become weak can be because of age. Because as the age advances, the lady gets deprived of the female hormones, the estrogen and the progesterone. Estrogen is very important to maintain a healthy ligament and muscles because it improves the blood supply of the muscles and it keeps the female healthy. So as the age advances, the hormones come down and the muscles, the elastin tissue, the collagen tissue, they start getting weak, and then in that case, not everybody but some females may have a prolapse. Now sometimes it can be simply hereditary, that the grandmother had it, the mother had it, and now the daughter is also having it. That is because of congenital weakness in the formation of these tissues, the collagen and the elastin. I have seen many cases who are very young, who do not even have a childbirth as yet, and they still have a prolapse. So such cases can be blamed on the hereditary factors. Now there are certain conditions like, for example, chronic coughing, chronic constipation, anything which increases the abdominal pressure and causes a pressure, a push on the pelvic floor can lead to damage and later on lead to prolapse, especially in the advancing age. Now, what are the different types of prolapse? The different types of prolapse can be classified into type 1, type 2, type 3 and type 4. Type 1 is where you have a bearing sensation, bearing down sensation. You feel that something is coming out. The doctor examines you and tells you that yes, your uterus has started coming down, but it is still inside the vagina. You still cannot see it because a doctor only knows that what is the normal position of the cervix, that is the mouth of the uterus. So when we examine you, we can tell you that it is not at the right position, it has come slightly down. Now this particular stage can be prevented, like it can be stopped at this particular stage. You cannot prevent, you cannot bring it back to the normal position, you cannot go back, you cannot make it stage 0, but you can prevent this getting into stage 2, 3 and 4 by doing regular Kegels exercises, that is perineal floor exercises, which I explained in my last video. And secondly, you can stop the childbirth, like if you have completed your family, you have to stop having a vaginal delivery again because vaginal delivery causes damage. Thirdly, you can correct the precipitating factors like chronic coughing, chronic constipation. These are the precipitating factors which lead to further on damage to the perineal muscles. Second category, the type 2, is when the cervix is seen at the mouth of the vagina. As soon as you lie down, the doctor tells you, yes, I can see the mouth of the cervix even without putting any instrument. So that is second degree, when the mouth of the cervix is sitting right at the introitus, and you can probably see it when you sit for the toilet. Right? This can also be prevented into going into further stages by the same 3 ways which I just told. But again, it cannot be pulled out. Now, stage 3, type 3. Type 3 is when the cervix and the uterus has started coming down and the obvious mass, that particular tissue, is seen hanging out. Even while standing, even while lying down, the doctor can see it and tell you that yes, the uterus has come out of the vagina, it is hanging out. Type 4 is the same as type 3, but it is a larger mass. You will feel that a larger mass is coming out, but the doctor will examine and tell you now the entire uterus is hanging out. You don't have anything inside your body, everything is out. So type 3 and type 4, do not wait for your doctor to keep explaining and keep calling you, just go and get a surgery done. Because if you do not get a surgery done, it will lead to further backache, it will lead to further ulcerations, it will lead to further complications, right? So the only corrective measure for type 3 and type 4 is surgery. Now coming back to what are the symptoms and signs, how will you come to know that you're having a prolapse? You will have a bearing down sensation. When the uterus is coming down, it is pulling on the ligaments and the muscles which are attached somewhere at the right place. So whenever they are like under tension, they will cause a lot of pain. It might be a lower abdominal pain or it might be lower backache. So that is very common during prolapse. The bearing down sensation as if you're giving birth to a child. Obviously the pain is not that bad, but you have that sensation that something is coming out. Then while passing urine, when you sit for the urine, you might not be able to pass entire urine. It might stop in the middle. That's because the bladder starts prolapsing along with the uterus, and that's called cystocele. So a sac of urine is formed which prolapses out, and you have to push it in to further evacuate your bladder, to further continue with the urination. Same happens with the passage of stool. In between you might feel that you are not able to pass because the sac, the rectocele sac is there, and because of that your satisfaction of completely passing the stools out is not there. So difficulty in defecation, difficulty in urination. Then you might have problems in intercourse. Sexual intercourse might be very painful because of this prolapsed mass. Sometimes you may have excessive discharge, white discharge. That is because something hanging down, the congestion increases, the blood vessels, the venous congestion increases. That causes loads of mucus discharge from the vagina, from the cervix, that is the mouth of the uterus. And sometimes if there is ulceration, if the erosion is there, the skin is eroded, then you might even bleed. So these are certain signs and symptoms which you can have during prolapse. Now what are the preventive ways? As I just said, Kegels exercises, avoid home deliveries, avoid chronic coughing and constipation, all those things which might increase your abdominal pressure. Even excessive gymming, excessive jumping might not be very good for you. So you just need to know what your body can tolerate. Coming to surgery, now there are two types of surgeries. One is vaginal surgery. Vaginal surgery, we just remove the uterus. We can never cure the actual problem, that is the weakness of the musculature, because that we cannot do with the stitches. We can just remove the mass which is hanging out so that you do not have that discomfort while walking, because when we are walking, that mass, that particular mass, the tissue which is protruding out, that will be very irritating for you. That will be very interfering in your normal day-to-day life. So we just remove that. All the stitches are in the vagina. Nothing needs to be removed. The day you have your surgery, you can walk, you can eat. The next day you get your catheter removed. The third day you are discharged out of the hospital. For 2 months you have to take care not to do any heavy weight lifting. You cannot maintain a sexual relationship for the next 2 months, but within 3 days you are discharged. You are up and about, you can roam about, you can do your normal day-to-day activities, and your stitches will normally dissolve within 1.5 to 2 months. So that is it. It's a very simple surgery. Coming to a new kind of surgery, which is laparoscopic surgery. In laparoscopic surgery, we sometimes do not even need to remove your uterus. We can just pull it up with the ligaments which have kind of elongated to allow your uterus to come out of the vagina. So we just pull them up and we plicate them, we cut them short, and we attach them to either the sacral promontory, which is a very broad bone of your spinal cord, and we kind of fix it there, or we kind of fix them to the ligaments, the muscles which are strong inside the abdomen. So in this case, we do not need to remove the uterus, and the backache and the prolapse which you were facing at that time, that kind of disappears. But again, you have to be precautious that you cannot have a childbirth after this, because if you have a childbirth, the entire surgery will fail. And secondly, you have to take care that the precipitating factors which I just told, the chronic cough and the constipation, had to be taken care of. Otherwise, these things will destroy the motive of the surgery. Coming to the recovery period, as I said before, the recovery period is again of around 2 months. There are no stitches in the laparoscopic surgery. There are no stitches in the vagina. So you do not need to put any cream there or any tube there. The stitches on the skin, on the abdomen, they dissolve within 7 days. The stitches that we take inside the abdomen to pull the ligaments up, they dissolve within one month or 2 months. So the recovery period is around 2 months, but then you are up and above within 2 days. You are roaming about in the house, and as I said before, you just cannot lift heavy weight. Otherwise, the recovery period is very fast. So just take care. Do not let your body become weak because of the precipitating factors. Prevent home deliveries, prevent coughing, prevent constipation. Just take medicines at the right time and try to be healthy. Keep doing pelvic floor exercises. and try and eat a balanced diet. And there are certain hereditary things which I just said, you cannot prevent that, but of course if you know that you can have this, then you can probably prevent it. There are certain hormonal treatments which can be given to ladies who are in the menopause, because estrogen actually prevents and is actually responsible for the strengthening of the muscles. So sometimes even external hormone therapy, that is HRT, can help you in preventing prolapse. Okay, so guys, this is all for today, and if you have any question, you can always inbox me in my YouTube channel, Ask Your Gynecologist, or you can follow me on my Instagram handle, sonal.parihar.33. Till then, take care, bye for now.